Hi guys, welcome to another episode of Red Flags. Today we're going to be talking about heart attack. A heart attack can be mild or it can be very severe, and in very unfortunate cases it can result in death straight away. What is a heart attack? A heart attack is a death of a part of the heart. So this obviously affects the oxygen carrying capacity of the heart itself, and that is why the heart is under strain, and that is why people typically have chest pain when they're having a heart attack. It's usually caused by a build-up of substances such as cholesterol and fat, which form a plaque in the arteries, and then this plaque ruptures and can block the coronary artery, and this results in a lack of oxygen supply to that part of the heart, which results in death of that part of the heart. What are some of the risk factors that are associated with heart attack? Well, being old, really. So the older you are, the harder your arteries are, and more cholesterol there is, more fat it is, more likely plaque will form there, and plaque can go on to rupture. So anyone over the age of 55 is susceptible to having a heart attack. If you're male, you're more at risk. If you're of South Asian origin, sadly, you're more at risk. If you've got other comorbidities such as type 2 diabetes, high cholesterol and high blood pressure, you're more at risk of having a heart attack. And then the unhealthy habits that some of us have, such as smoking and excessive alcohol consumption, a lack of physical activity, stress and obesity. These are all risk factors for having a heart attack. So how do you know if that pain in the chest is due to indigestion from a large meal, or if it's something to worry about? Well, firstly, look at your risk factors. Family history is actually quite important when you're thinking about a heart attack, because I have seen some heart attacks in very young men, and when you ask them why this may be, sometimes it is due to the risk factors that we talked about, but it could also be that a family member has died under the age of 55 from a large heart attack. So that's why taking a family history is so important, both when you're trying to get the sort of history from someone who's having a heart attack, and also when you're thinking about yourself. So you ask yourself, is there a family history of heart disease in my family? Do I know anyone under the age of 55 who's had a heart attack? And then you can also ask yourself those other questions. For example, if you're a 65-year-old man, if you're smoking 20 cigarettes a day, drinking lots of alcohol, quite obese, and then on top of that, you've been getting these chest pains that have been building up, particularly when you're putting the heart into strain. So if you're walking up a hill, or if it's in the cold and you've been getting these pangs, which are known as angina. So angina is often a warning for a heart attack, because that shows that there is something wrong in the coronary arteries and they're under strain. But it isn't a heart attack, it just shows that the heart is suffering, and the tissues have a lack of oxygen and a lack of perfusion, and then angina can often go on to go into a full-on heart attack, which is why you have to take, particularly if you've had a heart attack before, your GTN spray, because if this chest pain responds to GTN spray, that is showing that that is a symptom of angina. So some of the signs that you are having a heart attack are a crushing central chest pain, and this is often a vice-like pain or a band-like pain. So if I was taking a history, I'd say, does this pain spread across the chest, and is it quite central? So central crushing chest pain is a sign that you are having a heart attack. Often the pain is not something that you've experienced before, so it's not like the pain of indigestion, it's not like the suffocation that you can sometimes feel with asthma. It's a excruciating pain in the center of your chest, and it can be so bad that it can make you vomit. That's how bad it can be. It also spreads to different parts of the body as well. So it can be a central crushing chest pain, which can spread up to the neck and the jaw, and it can also spread on down the left arm as well. So these are symptoms associated with having a heart attack. You can feel quite lightheaded, you can feel nauseous, you can feel sweaty. And if it typically lasts for greater than 20 minutes and is not relieved by sort of over-the-counter medications such as paracetamol, then this is when I would urge you to go to A&E. If you live close to a hospital, get to A&E straight away, call an ambulance, 999. I think I'm having a heart attack, get someone else to sort of ring the ambulance for you. Some symptoms of a mild heart attack, particularly if you have things like type 2 diabetes or you're old. Some people don't even know they've had a heart attack. It's only when we look at their ECGs, which are the tracings of the heart, that we can see that they have had a heart attack. And then in retrospect, we might ask them and they might say, oh yeah, I had a little bit of pain in my tummy. So the very classic presentation of a heart attack is what I've just talked about, which is a central crushing chest pain, radiating to the jaw, radiating to the arm, sweaty, short of breath, particularly like a cold sweat, dizzy. Your heart can also go into an irregular rhythm, which is known as, so you can experience some heart palpitations as well. These are all the red flag symptoms of having a heart attack, so please be vigilant. Having said that, and this is where it gets tricky, there are some very atypical presentations associated with having a heart attack, and this can even be things like having pain in other parts of your body, which is what's known as a referred pain. Also, particularly in women, upper abdominal discomfort, epigastric pain, so your epigastric area is the area just below your chest area. That can also sometimes in women, that's kind of aching, hurting, a dull, heavy like pain, especially if you don't get pain down there. That can also be associated with a heart attack. But if you get any of these symptoms, if they're serious symptoms, straight to A&E, ring 999. And if there's just like sort of a niggling discomfort in the chest that you've had over a few days, particularly when your heart's under strain, when you're climbing stairs, when it's cold weather, because cold weather typically constricts the coronary artery, so your heart has to work a bit harder, which is why people sometimes get more chest pain in the colder weather. Then it's important to go to your GP and maybe get a treadmill test or an angiogram, so that we can be preventative rather than you coming to A&E with the symptoms of a heart attack. We can get on top of it quite quickly, and we can sort of do some more preventative measures for you. Fine, so I think that's long enough, that video. And just to sum up, red flag symptoms associated with a heart attack: central crushing chest pain, pain radiating to the jaw, pain radiating down the arm, sweating, pallor, shortness of breath, a pain that you've never experienced before. And then some of the risk factors: old, obese, type 2 diabetes, high cholesterol, smoking, drinking, severe stress, lack of physical exercise, and also any warning symptoms that you might have been experiencing, such as sometimes things like extreme fatigue, shortness of breath going up the stairs, a niggling pain in the chest, which is like an angina pain. Then please go to your GP if you're getting any of the warning symptoms, and put a stop to it before something serious happens. Okay, so I hope that was useful, and whistle stop tour of a heart attack. And if you've got any questions, I'd be happy to answer them, and if you write in the comment box below.